I like to use this bumpy foam roller for myself because it goes a little deeper. What we're trying to do is we're trying to find an adhesion or a knot and trying to find a sore spot. Whenever you roll out any muscle in your body, whenever you have a knot in your body, your muscles are contracted and they form a knot. Whenever you have a knot in your body and you apply pressure, it's going to feel some form of soreness and or maybe possibly sharp pain. Reason being is because you have tons of muscle fibers intertwined in one big bundle, and each muscle fiber has a nerve ending in it. So when they all intertwine, it gets really, really sore. Now, if you want to take this on a more practical approach, if you put pressure on a bone, say for example your elbow, you're not going to really feel too much, you'll just feel pressure. Bones typically do not feel anything unless they're broken. So whenever you're rolling out, you're looking for that soreness and or sharp pain. And what you want to do is you want to hold it until it releases. Now, knots release faster based off ischemic compression or time under tension. So you need to hold it for a period of time before it actually releases. Some knots can take a minute, some knots can take 5 minutes. I've actually held a knot rolling out for 30 minutes on my own body. It's just a matter of time before it releases. Now, if you don't have a lot of time, rule of thumb is 30 seconds to a minute. Eventually what's going to happen is you're going to get rid of all the knots in your body or whatever muscles that are affected in your body. Feel very loose, very flexible, and whenever a knot comes about, you're going to notice it. You're going to be like, oh, there's something tight on my body, and you're going to try to release it right away. And instead of taking a minute to 5 minutes to release, for example, it'll only take 5 to 10 seconds. And that's kind of the body that you want to have. You want to have a flexible and strong body. One of the worst bodies you can have is a very tight and weak body. So we're trying to promote flexibility and strength, and not the opposite in our training program. So first rollout is rolling out your calf. So you always want the roller about perpendicular to the muscle you're rolling out. It just makes it a little bit easier for you to target the specific muscle. We're going to start off with the gastroc, your calf, and your soleus. So this is all pressure based. So the more pressure you apply, the deeper it goes. And if it hurts too much, then obviously apply less pressure on your body. So you apply more pressure by crossing your leg over. And then what we're doing is we're starting off at one joint, so we're starting at the ankle, and we're following the insertion point all the way to the origin point, which is right below the knee, and that's where your calf is. So we're going to roll forward, and what we're looking for is a sore spot of sharp pain. Like right there feels a little bit sore to me, so I'm just going to hold that for a little bit. You don't need to roll back and forth, you don't need to do anything, and just hold it. And what's going to happen is you're applying pressure on the knot, and it's slowly, you're getting blood pressure in blood in the area, and it's slowly going to release. And when it starts releasing, the pain goes from wherever you start, maybe it's a 5 it starts off at, and it'll go down maybe to a 1 or a 2. And once it hits like a 1 or a 2, then you can find another spot. Found another spot right there. I'm going to hold that. Okay, I'm going to start off back at the ankle. Next, I'm going to work on the lateral gastroc, and it's very simple. All you have to do is rotate the foot outward, and you're going to be rolling out the lateral side of the calf, which is called your lateral gastroc. This muscle gets very tight if you walk, if you run a lot, and it also, when it gets overly contracted or hyperactive, it can rotate your feet out so you can walk like a duck, or your feet turn out when you walk, and that's considered a muscle imbalance. So we'll start again. We'll start at the ankle, and we're going to roll all the way to the knee, and we're looking for a sore spot. And I have a little sore spot right there, so I'm gonna hold that. Okay. And then you can also work on your medial gastroc by rotating your leg inward. Cross your leg over again, apply pressure, lift your butt up, and roll forward. Looking for that sore spot. Holding it until it releases. Usually, again, if the pain starts off at a 10, meaning worst pain possible that you can handle, you generally want to keep it around a 7, maybe a 6, so you can tolerate it more. And you're going to hold it until it turns into a 1 or a 2. Eventually it will release, it's just a matter of time. Alright, I'm going to check out my other calf now. So I'm going to do this a little bit quicker. I'm going to roll all the way to my knee. Feel a little something there. Released. I'm going to check my lateral gastroc. Feels good. And I'll check my medial. Nothing there. So that is how you roll out your calves. It's really straightforward. It's pretty simple. What we're looking for again is the adhesion or a knot or a sharp pain or soreness. Obviously, if you have any kind of skin condition, or you have a broken skin, or if you fractured a bone, don't roll out that area. It's not going to be helpful. What we're really trying to do is release adhesions, release knots in the muscle so that you have more range of motion, so you have less chance of pulling that muscle, less chance of hypercontracting that muscle, and reiterating better movement patterns and new muscle memory through your workouts. All right, next, we're going to check out the IT bands. Again, the roller is going to be perpendicular. Hip. And you're going to roll all the way to the knee. See if you feel it. For me, I don't have too many knots because I've been doing this for a while. And that feels a little sore, but not much. So ideally, when you roll out, you want to not have any soreness or sharp pain anywhere. It's like, imagine giving yourself when you go to a massage therapist and you get a deep tissue massage, the same soreness you feel is the same soreness that you're going to feel when you roll out. It's the same idea. It's all pressure based. And you're looking to get rid of those adhesions to promote more range of motion. All right, next let's check your adductors. So this one's going to be your inner thigh. What you're going to do is have the roller at a perpendicular angle to your leg, and rotate your leg outward. You're going to place it on the inner thigh, and then you're going to roll all the way to your knee. Find a spot and we're just going to hold it. When knots release, you're going to get this nice, warm, happy sensation in the area. It's increasing blood flow, increasing circulation, increasing range of motion. Your joints and muscles feel happy. All right, I'm going to switch legs because I don't have too many knots there. Something here. Just gonna hold that for a little bit. said before, this can take 5 minutes per knot. It can take 30 seconds. It can take 5 seconds. It just really depends on how tight you are and how much work you need to do in order to release those knots, those adhesions. Now, the more knots form due to muscle contractions. If you are sitting all day and your hamstrings, for example, are in a contracted position, right? Sitting, hamstrings in a contracted position. When a muscle is hypercontracted or just contracted in general, they tend to form knots. And or if you are active and you're running, for example, all the time, and you're plantar flexing, pushing from your calves when you run, your calves will form a knot through to contractions. So either way, your body is prone to forming knots just based off of living. So this is something that is a good tool for anyone to learn to make sure that they don't have any adhesions or knots in their body. Just again, so that way you promote good flexibility and good range of motion. Okay, next, let's do the quads. Quads are very simple. You start off at your hip flexor right at the top of the hip, and you're gonna roll all the way to the knee and see if you feel anything. This will be your rectus femoris, vastus lateralis, vastus medialis, and your iliopsoas. Alright, all that felt good for me. I'm going to switch sides. Start off my hip, iliopsoas. Roll down all the way to your knee and back. See if you feel any soreness anywhere. And once you do, you stop and hold it. Now with the quads, it wraps around your leg obviously, so you can rotate your knee inward and roll it out. Get more of your vastus lateralis. We got something on there, you want to hold that. Okay, that released. And then you can rotate your leg outward a little bit. Your vastus medialis. Okay, great. So we just pretty much did all of your legs. One thing that is not as common for most people is having tight shins. Now, if you have shin splints, your anterior tibialis could be tight. If your feet roll or turn in like pigeon-toed, your anterior tibialis would definitely be tight, so let's do that next. I personally played ice hockey for almost 10 years, and my shins got very, very, very tight and overused just from balancing and pushing off the ice. So you can do either one leg or 2 legs. I like to do 2. You're gonna roll all the way your ankles, and you're gonna roll all the way back. See if you feel it. And if you do one leg, it's easier to control. Like I feel something right there, so I'm gonna hold it. And you're hitting your anterior tibialis and your posterior tibialis here. Hold till it releases. And then move on. Turn your leg out. Ooh, that's a good spot. If you're stretching with me, please pause the video. That way you don't miss out on anything. Ooh, that feels great. Okay. Check the other leg. Rotate the leg inward. I'm doing my ankle, I'm rotating it inward. Sore right there. Now I'm going to rotate it that way. Put it down. A little sore right there. So I've been doing this for almost 20 years, so my knots release practically within seconds. If you are new to this, you might have no knots, or you might have knots everywhere. And again, it's just a matter of time. Knots form through muscle memory. So if you've been tight for many years, it'll take you, not years, but it'll take you a couple months for you to release your knots. For me, it took me about a good 6 months, 6 to 9 months before everything was released. And but after that, maintenance is really easy. I only stretch maybe 5-10 minutes a day now, specifically on the muscles that I'm exercising, and it doesn't take as much time. So depending how tight you are, your stretch program might take 30 minutes to an hour a day. Again, it just depends on how tight you are. All right, next. I want to reiterate how powerful this tool is, because you're giving yourself a light to medium, I would say, tissue massage every single day, potentially. So, of course, you hire a massage therapist to get areas that are hard for you to get, or if you just want to relax, or you need to go super deep, and the roller won't get that deep. But it's important to the amazing thing about this is that you're teaching yourself how to get rid of knots, and you're giving yourself a massage whenever you want, and that is the power behind this. And you're going to feel amazing. You're going to have increased circulation. You're going to feel better. It brings an overall sense of happiness. You're going to have to be more flexible. There's a lot of benefits, not just injury prevention and correction, but just to rolling out and stretching. Okay, next, we're going to check out the lats. So lats are a huge muscle in the upper back, and you usually want to start at the kind of the top of the rib cage, and you're going to roll all the way to your armpit and back. And what we're looking for is, again, that soreness for sharp pain. I have a little something here, so I'm going to hold it. And again, you can lean back, lean forward, and feel and see where it feels most sore. Okay, mine released. We're going to do our chest, our pecs. This one's pretty simple. You lay on your chest, have your arm out like so, and then you're going to roll to the inner chest and back up. Side. You're trying to relax here. You're not trying to strain yourself. You're not trying to tense up. The more you relax, the faster it goes. So breathing is also very important. Breathing in your nose, out your mouth. The longer you breathe out, the more you can relax. All right. Last one I want to do is for your thoracic spine. When you sit for a long time, it is quite common for you to slouch. What happens is your thoracic spinal flexors get really, really tight, those muscles in your thoracic spine. And what happens is your thoracic spine starts fusing that way. So you might see some people who start slouching and then they lower and lower and lower and they're kind of stuck there. Just because the spine is not meant to be mobile, it's meant to be somewhat sturdy. You have a ton of ligaments that are holding the spine in place. So it's really hard to manipulate the spine, move it one way or another. So this next one I like to do is for your thoracic spine and trying to promote the flexibility of opening up the chest and everything that you do, everything that is the opposite of what you do when you sit in a chair, for example, at work or whatnot. Okay. The roller is right below my scapula, and what I'm gonna do is I'm gonna lean back and get my head and elbows touch the floor with my butt on the floor. And what I'm gonna do is hold this. Now, you might notice it's hard for you to breathe, and that's okay. You're also stretching your diaphragm, and it's pushing against your diaphragm too. You want to hold that for maybe 5 to 10 minutes a day, especially if you have a forward shoulders and a forward head syndrome. And that's going to help open up passively everything in the everything that's causing your head and shoulders to go forward, like so. So that is a great stretch to do. One more that we forgot to do is your piriformis and your butt tends to be tight. So what we're gonna do is sit on your butt, cross one leg over, and you're gonna roll your butt up and down. Ooh, I got a spot right there. Hold that till it releases. If you have sciatica, this is a great exercise to do. Like I said before, your sciatic nerve runs through your piriformis. So the sciatic nerve can be pinched via your piriformis. I know it's a catch-22. The more you push on the piriformis, the more you feel your sciatica. But once the knot releases, you're not going to feel the pain anymore. As long as the sciatic nerve is being pinched through your glutes and not through your lumbar spine. Get that released. Check the other side. Cross your leg over, open up the glute. Ease your access for the piriformis. All right, come over here, we'll do one more. We're gonna check out the lower back. All you're gonna do is roll. See if you feel anything in the lower back. Good ab workout too. And then you can also check the lower back. See if you feel anything up here. Get your rhomboids too.